Thanks very much. So in this session, I was asked to speak about eating for healthy eyes, nutrition, and retinal eye disease. So what I plan to do then over the next 20 to 25 minutes is tell a little bit of story. To start off, to tell the story of nutrition with respect to macular degeneration. And then I'll make some comments on some of the other conditions that affect the retina that may be modified by what we eat. Then I'll wrap up with a summary conclusion and leave lots of time. I'll try to leave lots of time for questions. When we first think of the topic of nutrition for retinal eye disease, the story goes back really to the Airit trials, and long before that, when there were nutritional supplements that were being offered by companies and pharmaceutical industries for patients, and these were touted as ways of stopping eye disease, stopping cataract, stopping glaucoma, stopping macular degeneration. And we in the field, actually, I think many of the physicians thought that we need to do some rigorous scientific investigations, some trials, in order to determine if patients should really be spending their money on these nutrition supplements, or can we say that just trying to maintain a healthy lifestyle is all that people need. And that led to the Airit 1 and Airit 2 trials, some of the most famous studies now that are completed within ophthalmology, so we'll definitely speak about those. We'll be speaking mostly about macular degeneration. That's because macular degeneration, as we know, is and remains the leading cause of blindness in Canada today, affecting people over the age of 55. And as our population changes, this is becoming a more and more common disease. So it's relevant to start by discussing it. We'll talk about macular degeneration. We'll talk about dry macular degeneration. If you weren't here this morning, remember that has two types, macular degeneration, the wet and the dry form. The wet form, we now have excellent therapies, intravitreal injections, which help to curtail vision loss due to wet macular degeneration. But dry macular degeneration is actually more common. 9 out of 10 people with macular degeneration actually have the dry form. And so we've been, over the years, really trying to look for some therapies that may help people with dry macular degeneration. So dry degeneration only accounts for 10% of blindness due to AMD, but that percentage is rising as wet macular degeneration becomes more treatable with our injections. So in terms of treatment options for dry macular degeneration, we know there's no cure for dry macular degeneration. And the percentage of people blind from dry AMD rises as we are more and more effective treating wet macular degeneration. We knew, and we've known for a long time, and there's good evidence to support that lifestyle modification does help to decrease your risk for dry macular degeneration and does help to decrease the progression of dry macular degeneration. By lifestyle modification specifically, we mean quit smoking. That's the number one thing. So if you know people out there with AMD that are smoking, please let them know that that's the most important modifiable risk factor. We know that maintaining a healthy body weight with good blood pressure control and exercise is very healthy, very helpful for macular degeneration, preventing progression. We have increasing evidence that reducing exposure to the ultraviolet light is important, so wearing sunglasses when you're outside can be helpful. And for a long time, we've known, or at least had good evidence to suggest, that eating fresh fruits and vegetables and thereby having a healthy diet is certainly important for preventing macular degeneration. But really the role of nutrients and which nutrients plays a role in macular degeneration, both therapy and prevention of dry AMD, was a bit of a question until the National Institutes of Health began to look at this with the Airit trials. Airit standing for Age-Related Eye Disease Study. And this was a massive undertaking, a huge multi-center randomized clinical trial that followed patients for 10 years. That's a long time, and that's an expensive period of time over which to follow patients. And it looked to assess the risk of progression from dry degeneration, which is usually associated with good vision, to wet degeneration, or the progression from dry degeneration to visual loss from dry degeneration, which means the onset of geographic atrophy, basically widespread dry degeneration in the macula. And initially, and to be honest, even some of the people who designed this study thought that these vitamin supplements would likely not be beneficial. And they did this to sort of prove to patients that you don't have to spend extra money supplementing yourself if you have a good diet. But this study produced some very interesting results. After 5 years, it showed that the risk of vision loss could be reduced by 25% if you took an extra dose of the vitamins that were recommended by the study. Specifically, that was vitamin C, vitamin E, beta-carotene, zinc, and copper. So if you took those, you were 25% less likely to suffer loss of vision. Now, in order to be in that group, you had to have some macular degeneration to start with. So these were people who already had it. The people in this study who had none to minimal changes of macular degeneration, their rate of progression over 5 and 10 years was so low that they couldn't see a statistical treatment benefit from supplementation. But if you had significant disease to begin with, they proved conclusively that you could reduce the rate of progression by supplementing with vitamin E, vitamin C, beta-carotene, zinc, and copper. In addition, in the study, it asked the question, is it also safe to take a general purpose multivitamin? Because many patients were doing that, and the answer is yes. You could take Centrum Silver in addition, and that was fine. Now, that was the first Airit study. More recently, we have Airit 2, the second age-related eye disease study. And what that looked at is to see if we could lower the concentration of zinc, because zinc, one of these supplements from the original Airit study, was associated with some GI or gastrointestinal upset, or basically upset stomach. Additionally, there were new compounds which were now available as supplements, which were not available during the first Airit study. That's lutein, zeaxanthine, and omega-3 fatty acids. And these weren't widely commercially available at the time Airit 1 was studied, but there was developing evidence that these were additionally beneficial to the eye, so they wanted to study those. So that was what the purpose of Airit 2. And the question is, why would these nutrients and vitamins help us? Well, we have to recall that the retina is perhaps the most metabolically active part of our body. And this high rate of metabolism, this high turnover, all the work it's doing to interpret all the light that's coming into the eye, creates the buildup of byproducts of cellular metabolism. So there's some waste products that build up, specifically oxygen-free radicals. And these oxygen-free radicals that build up as retina is doing its work and consuming its energy, they're the waste products of metabolism, they tend to cause the breakdown of healthy cells and the membranes around healthy cells. And it was felt that that is one of the primary steps in the pathology of macular degeneration to start off the whole dry macular degeneration cascade. So when you have excessive oxygen-free radicals and other byproducts of cellular metabolism in the retina, you'll produce more drusen and there'll be more loss of your retinal cells. Now, factors that lead to higher production of these oxygen-free radicals and byproducts of cellular metabolism are age, low intake of antioxidants and healthy vitamins in your diet, excessive exposure to blue light or the ultraviolet light, smoking, and pollution. So all the things that we knew we could modify, they primarily work by decreasing the burden of waste products of metabolism on the retina. They damage the retinal pigment epithelium. They damage the photoreceptors by reacting with their cell membranes and slowly degrading those cells. And remember, these cells do not regenerate, so that they cannot reproduce new healthy components of your retina, so you have to protect what you have back there. So the target of stopping these byproducts of cellular metabolism are first to stop their production in the first place, and that's where lutein and zeaxanthine come in. So lutein and zeaxanthine are capable of absorbing the harmful ultraviolet light that comes into our eyes, which will produce these oxygen-free radicals, so they block them. And the other way to stop their negative effect is to mop them up once they are formed within the eye. And so antioxidants are what bind to oxygen-free radicals, absorb them so that they can't hurt the cells in the back of the eyes. So there's primarily two types of antioxidants. Those are the nutrients, such as lutein, zeaxanthin, beta-carotene. These are called the carotenoids. And then there's vitamin C and vitamin E. Then there are enzymes which help to break down oxygen-free radicals, and they include zinc, catalase, and glutathione. So those are ways that you can break down the ones that are already formed inside your body. Now, recently there's been a lot of interest in the carotenoids. Those include the lutein, zeaxanthin, and beta-carotene. These come from plants that we eat, the oxygen-containing pigments within plants. So colored vegetables, the green, the yellow, the colorful vegetables are what contain these. So good examples are the greens that we eat, spinach, broccoli, carrots, corn, and many fruits that we eat as well. And they supply us with lutein and zeaxanthin, which are felt to be very protective to the eye. They work, the lutein and the zeaxanthin work, as you consume more of them, there's more of them in your blood, more of them will deposit in your macula, and you can measure that people who have higher intake of this have a higher macular pigment density, and that is able to absorb the harmful ultraviolet light and protect the retina. There's some good clinical studies that show that these can be beneficial even if you don't have any macular degeneration to begin with. So one of the widely quoted papers was from the Journal of the American Medical Association back in 2005. And they took a large group of thousands of people and tried to survey what they were eating, and then based on what they were consuming, stratify their risk for developing macular degeneration. So they followed those patients forward and to look to see if there was any new onset macular degeneration. And what they did was they stratified how much people were consuming of beta-carotene, vitamin C, vitamin E, and zinc. And they broke it into three groups. Those that consumed less than normal amount, those that consumed the normal amount, and then the third that consumed the higher amount. So they took the total population divided into groups of three, low, normal, and high, a third, a third, a third. And it turned out that there was a 35% reduction in new onset dry macular degeneration if you were in the high group. So if you consumed a lot of beta-carotene, vitamin C, vitamin E, and zinc, a 35% risk reduction. If you were in the low group, the low one-third, then you had an increased risk of 20% increased rate of developing dry macular degeneration. And so that led to the production of some of the pharmaceutical supplements that you'll see, for example, medicines like Healthy Eyes and supplements like that, that try to supplement you with the recommended dosage that would put you into the high category, according to that study, to try to prevent the onset, the new onset of dry macular degeneration. The challenge is that our body cannot synthesize these antioxidants ourselves. So they entirely are consumed and received from our diet. And we know that the North American diet is changing significantly. We eat less fish, for example. We tend to eat less fresh fruits and vegetables. And this tendency towards fast food and prepared food has really reduced the amount of these healthy nutrients that are contained within our diet. And thereby, it allows people a choice, if it's difficult to modify your diet, to purchase and consume some of these pharmaceutically produced ocular vitamin supplements in order to ensure that you're reaching the minimum daily requirements to be considered in that high supplement group to reduce your risk of onset of macular degeneration. Now, with that as a background of how helpful some of these nutrients could be for the eye, I wanted to talk a bit about the Airit 2 study, the second study that came out just recently. And what that did was try to refine a little bit more the beneficial role played by some of the constitutes of the Airit 1 study, as well as look at the addition of zeaxanthin, lutein, and omega-3 fatty acids. So the Airit 2 study was to look at how much better could we do. We knew from Airit 1 that we could reduce the risk of progression by 25% with these supplements. So Airit 2 had a very lofty goal to see if we could even reduce that rate more. And so what it did was it took the original Airit 1 formulation, the vitamin C, vitamin E, beta-carotene, zinc, and copper, and it first of all wanted to see if we could get rid of the potentially dangerous parts of that mixture. So specifically the beta-carotene. The beta-carotene was known to increase your risk of lung cancer if you were a smoker. And remember, smoking is the biggest risk factor for dry age-related macular degeneration to begin with. So a lot of people had the disease and were smokers. Okay, and a smoker means somebody who is smoking or stopped within the last year. So to reduce their risk of lung cancer, they wanted to see if they could eliminate the beta-carotene. The zinc had been postulated as one of the reasons why some people couldn't handle these supplements and that it was upsetting their stomach. So they wanted to reduce the zinc in these supplements and see if they was still conferring as much benefit. And then they wanted to add the lutein and zeaxanthin, and they wanted to add the omega-3 fatty acids. So again, the lutein and zeaxanthin, they come from those colorful vegetables like spinach, kale, and other greens. And the omega-3 fatty acids primarily come from fatty fish, salmon, and things like that. There was good evidence based on the Airit 1 trial when they went back and reanalyzed the data that people who were taking a lot of lutein and zeaxanthin, so if their intake was higher than normal, they had less risk of large drusen, those large soft drusen that are associated with vision loss. They had less risk of geographic atrophy. That's the way that people with dry macular degeneration lose vision. And they had less risk of new onset wet macular degeneration if they had high intake. Also, the same analyzing the people in the original Airit study showed that if you took omega-3 fatty acids and if you had high dietary intake of that, you weren't taking it as a supplement, but if your diet was rich in the fish that supplied that, you had less onset of wet macular degeneration and less onset of geographic atrophy. So there was potential therefore, and they expected to show benefit from both the omega-3 fatty acids and the supplements with lutein and zeaxanthin. So the second Airit study was kind of a complicated study. Again, they started off similar to Airit 1. They took 5,000 patients and they randomized them into 4 different groups. So the one group had the normal Airit supplements. The next group had the low zinc. The next group had the addition of the lutein and zeaxanthin, and then another group with the addition of the omega-3 fatty acids. And at the same time, they were randomizing whether or not the patients received the beta-carotene. So it was a large group of patients, but they were subdivided into many subgroups. So some of them were getting beta-carotene, some of them weren't, some of them getting lutein, some of them weren't, some of them getting high zinc, some of them getting low zinc. So it was actually a rather complicated number of patients, but it still left several hundred patients in each of the groups, and these were analyzed for 5 to 7 years. So we did get very good data from this study. Now, what did the results tell us? Well, the results were published recently in the Journal of the American Medical Association. And basically, the first thing they looked at was, I'll just advance to it here, what was the effect of the lutein and zeaxanthin? So we knew over 5 years from the original Airit 1 study, and it was confirmed in this study, that your risk of developing severe macular degeneration over 5 years was 30% if you already had significant changes. If you supplemented them with lutein and zeaxanthin, it reduced that risk by 10%. So that's 10% in addition to the 25% reduction that came from the original Airit supplements. So you were 10% further reduced. So lutein and zeaxanthin definitely helped more. The surprising result had to do with the omega-3 fatty acids. When they looked at the group of patients who were receiving the same placebo as before, the Airit 1 combination, and they added in omega-3 fatty acids, they found actually that their risk of getting worsening macular degeneration was higher. So this was not in a result that was anticipated. And it was just very slightly higher, but it raised some red flags. Then they looked at, well, what if you got lutein, zeaxanthin, and omega-3 fatty acids? Well, you were still lower than the baseline group, but you didn't do as well as if you only got lutein and zeaxanthin. So the best supplement was actually the Airit 1 plus lutein and zeaxanthin, but not with the omega-3 fatty acids. Then they looked, so that was their first conclusion, that lutein and zeaxanthin conferred additional benefit, but the omega-3 fatty acids didn't seem to have any added effect at all. Then they looked to see, well, what if we took out the beta-carotene? And again, they did the study, so they analyzed the groups with no beta-carotene. And it turns out if you just remove beta-carotene from your supplements, you don't do as well. So beta-carotene was actually doing something to confer additional protection. But then they looked at the group that had no beta-carotene, but they put the lutein and zeaxanthin in. These are all three other macular carotenoids. So you were substituting one carotenoid for another. And it turned out that if you took lutein and zeaxanthin instead of beta-carotene, you did much better. You did better than in the original Airit's study. So your risk was actually improved if you took out the beta-carotene but added in lutein and zeaxanthin. So you couldn't just take out the beta-carotene, you had to add back lutein and zeaxanthin to confer additional risk. Then finally they looked at the role of zinc. So they analyzed the zinc at the higher and lower concentrations, and it made no difference. But it also made no difference for people's GI upset, tummy upset. So it turns out by reducing zinc, we don't make these formulations any easier to tolerate. And as a result, the recommendation was leave zinc alone. So keep it at its original study level, which was very well studied and which was proven to have a significant benefit on progression. So the overall conclusion was take out beta-carotene, add in lutein and zeaxanthin, but don't touch the zinc concentration. And there is no need from a macular degeneration standpoint to add in the omega-3 fatty acids. So there's lots of lists now that show the new formulations out there. The Airit's 2 recommendations, they strike through the beta-carotene, they add lutein, zeaxanthin, and they don't have omega-3 fatty acids, but they have the same amount of original zinc. Now there's some discussion that goes on when people analyze this study. It was a complicated study. There was many subgroups, so it was more complicated than the first Airit's trial, but still the results seem fairly clear. The other thing to know is that this was in a group of individuals in the United States of America that came from a very highly educated and well-nourished population. So these people entered the study because they wanted to know if what they were doing was enough or if they should add in even more supplements. So this did not represent the normal, average, standard American or Canadian person. These people are already being better nourished if you look at their baseline, the composition of what was in their body at the time they entered the study. So there's some people that believe that the omega-3 fatty acids still have an important role to play in the general population, the people who aren't eating as well as they should be to begin with. Also, omega-3 fatty acids have been proven to be beneficial for other parts of our body. The eye itself, for the front of the eye, they help they help us prevent dry eye and keep a nice, healthy cornea. Omega-3 fatty acids have also been shown beneficial to prevent heart disease, neurological conditions such as Alzheimer's, and even rheumatoid arthritis. So there are reasons why people are still taking extra fish and supplementing themselves with omega-3 fatty acids. However, we cannot say that it will have any beneficial effect for you in terms of dry macular degeneration. So there'll probably be more to come as they try to subdivide this study and look at people that weren't as well nourished to see if they should be taking more or less of these vitamins. But as we wait, we're going to see now the pharmaceutical industry will start to produce specifically designed Airit's 2 supplements, and there'll be Airit's 2 formulations of vitamins that are coming out now for you to take to make sure you're taking everything you can in order to prevent dry macular degeneration. As we wait for those supplements to come out, remember there's nothing wrong with the Airit's 1 data. The Airit's 1 data still confers a 25% reduction in progression of AMD, and therefore it's still recommended to use the Airit 1 supplements as we're waiting for Airit's 2. There's no need to throw out the Airit's 1 at all. Now, I just wanted to briefly comment on some of the other eye diseases before we open it up for discussions and questions. Now, I treat a lot of macular degeneration, and I have less clinical involvement in some of the other conditions, but I will comment first of all on retinitis pigmentosa. Retinitis pigmentosa, we know that many nutritional supplements have been recommended over the years. The best data we have supports the use of vitamin A as a supplement. So vitamin A up to 15,000 international units a day. There are studies that show that this is beneficial and that this reduces the rate of photoreceptor degeneration by 20% over 5 years. So it's a very similar benefit as we saw for macular degeneration. There is a Canadian collaborative meta-analysis. So that was a project led here in Canada, which analyzed a bunch of smaller studies to see if they can pool that data into one larger study to see if there is actually significant evidence to support that. And it turns out, according to that study, that yes, there was. So that vitamin A supplementation does appear to reduce the progression of retinitis pigmentosa. Now, you have to know about vitamin A that there can be some side effects from over-supplementation. So it is associated with liver toxicity. So people that are taking high-dose vitamin A do need to check with their family doctor to make sure that their liver is working well. And it is also associated with birth defects. So women of the childbearing potential have to be very careful with the supplements. And finally, acute toxicity of vitamin A is associated with cerebral edema or brain swelling. So if you take a tremendous dose all at once, try to make up for years of not consuming vitamin A, you'll set yourself up for a real potential disaster. Other vitamins for retinitis pigmentosa, vitamin E. So vitamin E was studied. One study showed no measurable benefit. But there is evidence from other studies that in general antioxidant supplements, so vitamin E, vitamin C, and some of the other ones together, may confer benefit. It didn't quite reach statistical significance, but there's been a trend towards those helping. What about omega-3 fatty acids? Well, there was 2 studies that looked at patients with retinitis pigmentosa and measured how much omega-3 was in their system and followed those patients forward to see their rate of retinal degeneration as evidenced by ERG changes. And both of those studies showed that if you had high omega-3 in your system, your rate of progression was less. Sadly, however, the follow-up studies, and these were smaller studies, that actually supplemented people with omega-3 fatty acids, didn't show that the supplements yielded any or conferred any additional benefit. So when they supplemented people, there wasn't a benefit seen. So at this time, there's no clinical or epidemiological evidence to support either vitamin E or omega-3 fatty acids for retinitis pigmentosa. What about some of the other retinal dystrophies like cone dystrophy, rod cone dystrophy? Again, the clinical studies out there in these conditions, they're really not out there. There hasn't been much work. Probably has to do with the total number of patients and the disease burden of these conditions. So many of the recommendations that some clinicians are making is sort of inferred from our results for other retinal diseases. If it's good for one retinal disease, it protects the retina in general and is therefore good for another retinal disease, which is a bit of a leap of faith, but it does have some scientific validity. And so people have been suggesting for the cone rod and cone dystrophies that vitamin A, omega-3 fatty acids, and lutein may be beneficial. But if you really look into it, it's largely based on the fact that there's an argument made to say if they're protective for one retinal disease, they should be protective for another. Recall again, though, that if you take too much vitamin A, because people have been known to over-supplement for these conditions, you can run into some toxicity effects. For other macular dystrophies like Stargardt's, Best disease, pattern dystrophy, Sorsby's dystrophies, those different macular degenerations, again, we lack any good scientific evidence to make a specific recommendation about any nutrient being beneficial in those cases. In fact, you have to sort of stretch to find a retinal condition for which there's good, solid evidence. One of them is gyrate atrophy. So gyrate atrophy is a degenerative condition of the choroid and the retina, and there's been conclusive evidence that people with this do benefit from vitamin B6 supplementation. So there's one rare disease where we do have some good evidence that vitamin supplementation is truly beneficial. So to summarize then, there's been a revolution in our treatment of macular degeneration, both dry and wet. Wet disease was revolutionized by a treatment with anti-VEGF therapy. Dry disease have undergone a revolution in that we now have something to offer people and that there's good evidence with the Airit studies. Airids 1 found a 25% reduction in severe visual loss with the Airids 1 supplements. Airids 2 further refined the choice of supplements we can use, and if you modify it according to the Airids 2 recommendations, it confers an additional 10% benefit. Vitamins have also been postulated for other retinal diseases, but we caution with over-supplementation, and we caution with the need to follow with your family doctor if you are high-dose supplements like vitamin A. And most of the data outside of macular degeneration is smaller studies, and results are attempted to be generalized to other retinal conditions based on what we've seen proven clinically in macular degeneration. So there was a question here at the front. Airids, Vitalux. So Vitalux, is that Airids 1 or 2? So Vitalux Airids is Airids 1. So the brand name Vitalux actually has Vitalux S. Vitalux S has no beta-carotene. It now has lutein and zeaxanthin. And therefore, it is the closest one to the Airids 2 recommendation, is the Vitalux Airids S. Now, there's other companies, there's Preservision, there's iCaps, there's other companies out there that have excellent vitamin supplements as well. And you just have to check with what's on their package to see how close it is to Airids 1 or Airids 2. And I know that all of the major producers are looking to have specific Airids 2 vitamin packages available. Yeah. So another question here was, if you're on Vitalux, do you need to take another supplement? In the trial, the patients were on Centrum Silver. So yes, it is safe to take a general vitamin supplement in addition to your specific ocular supplements if you're worried about supplementation of calcium for osteoporosis or anything else in your body.
Hello, Dr. Hurley.
Hello again.
We've just made an appointment with that new machine that young girl has tried and she was able to see. What's the name of the machine? E-Sight.
Excellent.
And I was just wondering, do you agree with me doing that? Do you think that it's reasonable for me to try and do that?
Yeah, so I've always believed that we have to maximize our use of our vision any way that we can. So, a lot of my patients with wet macular degeneration or other diseases come to a point, maybe there's scarring in their retina, where I can't offer them much benefit by injections. And in those individuals, I think it's an excellent idea to look towards technology, to look to any of these vision enhancement tools that are available to see if they can help. Why not? There's no risk. See if it helps you. Hopefully you can adapt and have a nice benefit.
Dr. Hurley, a quick question about omega-3 supplements. My understanding was, somewhere I read, that they're not as effective as getting omega-3 from the fish themselves.
Yes.
You want to comment on that?
Okay, so the way that the supplements are prepared influences our absorption of them. So there are different companies out there that have different formulations. The company that has the one that is most similar to the natural omega-3 that we'd eat has data, but a very limited number of patients, that their omega-3 supplement is better absorbed into your bloodstream. There is also evidence that a truly natural source, the fish itself, has the best ability to increase what we can measure circulating in your bloodstream. So I think it's probably true that the best way to get anything that you require in your body is to eat it from its most natural source possible. The limit there is that many of us have reasons why we can't consume as much fish as we should, and therefore look to a supplement. And I think all the supplements that are on the market have been tested to enough rigor that they will increase. So they're better than nothing, that's for sure. But of course, the most natural form may be the best form, and there are some studies that would suggest that, yes.
Right over here,
Yes, I'd like to know how Ocuvite with lutein rates. the vitamin Ocuvite.
Yeah, absolutely. So Ocuvite is an excellent alternative. Ocuvite with lutein. I can't quote the exact constituents of that, but I think the last time I checked, it was perfectly matched according to the Airit's recommendations.
Hi. Just wondering if drinking carrot juice will help.
Yeah, so it's a lot better than some of the other stuff you could drink, like pop. That's for sure. Eating carrots, there's some things like carrots and bilberries and blueberries. Like if you know the story between blueberries and bilberries, and some of these things come from World War II. We got a lot of interesting history in our eyes from the Second World War, and one of them was this whole theory that the fighter pilots that lived near the blueberry and bilberry fields were seeing a lot better and were shooting down more German planes leaving from England. It turns out that those were the airfields that actually had radar, and that probably was better than any improved vision. So this is one of the things where you can infer a secondary outcome, shooting down more planes, and try to attribute it to another fact, the pilots were seeing better, when actually it was a spurious result. They happened to be near the radar fields. So you have to be a little bit careful in some of your leaps of faith without first testing the data rigorously. Beta-carotene, if you get it in juice like carrot juice, perfect. One way of supplementing yourself with that. And certainly it's better than some of the other sugar-containing juices that are out there. Got something right up front here.
Dr. Hurley, I've heard that many ophthalmologists in the U.S. have been recommending mega doses of vitamin A together with omega-3 and lutein for people who have photoreceptor conditions. Yes. In other words, not macular degeneration, but cone rod, Stargardt, things like that.
Yeah, so again, that comes primarily from inferring that if it's good for one form of photoreceptor degeneration, retinitis pigmentosa, photoreceptors are also affected in AMD, that it may be good in this other form. So vitamin A does have some solid evidence that it does help. Again, the level of evidence for some of the other recommendations are much lower, so you have to be a bit careful before you believe them and action on them. And again, there's the potential for toxicity, and that's why it's good to maintain a relationship with your family doctor. Make sure that your primary care physician is aware of what you might be supplementing with, so they can do the appropriate blood test to make sure the rest of your body stays healthy. Yeah.
Hi, Dr. Hurley. I have a 15-year-old son who has choroideremia, and I'm just a little bit confused about the findings with the Airit study about beta-carotene not being useful. What is the relationship between vitamin A and beta-carotene? So the risk of beta-carotene not being useful. So beta-carotene is useful. It's dangerous if you smoke to cause lung cancer. Okay, so if you've never smoked or not smoked, it's never been proven to be harmful in any way. Okay.
And that comes from actually some studies where they thought it would stop lung cancer. So they're taking smokers, giving them these high dose of antioxidants and trying to prevent their development of lung cancer. And it turned out in that study, people getting beta-carotene actually had a higher risk of lung cancer.
So you would recommend then, and I'll talk to his family doctor about it too, that the 15,000 units of vitamin A wouldn't be harmful to a developing teenage boy. Okay. And also, would you recommend the vitamin B6?
So he has choroideremia.
Yeah.
So again, it's difficult for me as a clinician to say, okay, we have evidence that supports the use of these in choroideremia. Yeah. We have evidence that supports their use in some retinal diseases. To say that it would help choroideremia, we're taking that sort of extra jump. Yeah. So, in general, we feel that these are important components to have in our body circulating around to help with the growth, development, and maintenance of our retina. But we can't say it's specifically good for that condition without having some evidence within that. We do know that people who supplement with these, so in the Airids 1 and Airids 2 study, people who are on the supplements were healthier, lived longer, had less mortality than people that weren't. So I say to my patients, we know they're safe. Okay, so these are safe. Therefore, it's probably not harmful to use them. just making sure you're not overdoing it. I caution people that they think, okay, 1 pill is better, 3 pills would be even better than that. So don't overdo it. But so there's nothing to say it would be harmful, but there's also no good evidence to say for that specific condition they'd be helpful.
At what age would you recommend people start taking supplements, like if you have a healthy diet and stuff?
So I don't push supplements as much as I push other lifestyle modifications. Don't smoke, exercise, try to maintain healthy body weight, watch your cholesterol. These things that help the body in general certainly help the eye. Then at what age should you start to supplement at? I guess it would be the age where you think that your overall nutritional intake is suboptimal. But you have to stratify that with your own individual risk. So if there's a strong risk of macular degeneration within the family, if you start to have some changes of early macular degeneration, that would tend to argue towards suggesting supplements be started. But again, the best thing I think people can do, rather than go and spend their money on vitamins, is to modify those other really simple things in life. Avoid the fatty foods and get some exercise. Those things are very helpful. And then if you think, okay, I'm already doing those things and I want to do one thing more, that's when you can start the vitamins. Most studies didn't supplement anybody under the age of 55, though.
Thank you.
Thank you. You've been talking about beta-carotene being linked to cancer and people who were smokers.
Correct.
What about people who were quite serious secondhand smokers?
Yeah. Excellent question. And the latest recommendation I had on that is if there was a lot of secondhand smoke, then you should probably consider yourself as having smoked. So what is a smoker? Well, the best definition I have is somebody who their exposure stopped within the last 12 months. Okay, so if even up to recently you had a lot of that, then you should consider not using beta-carotene. Again, if you substitute lutein and zeaxanthine for the beta-carotene, you're just as well off. So that's an excellent way of doing it. Avoid the beta-carotene and take the lutein and zeaxanthine. Now, if the secondhand smoke exposure was many, many years ago, 15 years ago, when you were a child growing up, it probably has no bearing. You can consider yourself a non-smoker. All right. Excellent. I think that wraps up our time. So thank you again very much for your attention. That was a really enjoyable session.